vaccination is a safe procedure. It's amazingly cheap when you look at the cost for an individual vaccine, and the benefits are extraordinary. The problem is that vaccination is also a victim of its own success. Now, if you go back to the 1950s, during around 1955, when the vaccine for polio was first developed, people in America were terrified of polio, and it was said at the time that the only thing that people are more frightened of in America than polio is the atomic bomb. At a time when a child could go to bed well, wake up the next morning paralysed, families all over the world were absolutely terrified of the effect of polio. During the 1939 epidemic in Australia, my father was a teenager, and they closed the bridges across the Yarra because they thought that the disease was on one side and they didn't want people to travel. That's how scared people were about it. If you get rid of that disease with vaccination, then nobody has a personal experience of it, and I'm afraid that there's nothing more powerful than personal experience. So, as the disease disappears, all that people see is the vaccine. There's no such thing as a medical intervention that works that doesn't have some risk. There's no medicine that you can give anybody that works against disease that doesn't carry with it a risk of side effect of some sort. Now, you have to balance the risk of the side effects, the risk of the medication, with the benefit that you might get from the treatment. So, if someone's got cancer, then you'd be prepared to give a drug that's got quite significant side effects because the thing you're treating is cancer, therefore we'll take that risk. But when we're talking about vaccine, we've got otherwise healthy people, and we're saying to them, take this vaccine to prevent a disease. So the vaccine has to be incredibly safe. And over the years, over the last 200 years, through the amazing experience that's grown up with vaccine development, vaccines have become safer and safer and safer. England in the 1990s, after the autism association was made between the MMR, the measles, mumps and rubella vaccine, and autism. Now that was totally false. It was a false claim. It was proved to be wrong, and all of the large studies that have been done in the 15 years, nearly 20 years since that study was released, have not shown a single shred of evidence that there's a relationship between MMR and autism. So we know that it was wrong. We know that it was wrong. But the vaccine coverage rates in the United Kingdom fell from over 90% to about 80%, and thousands of cases of measles occurred in that time. So the disease occurred, people started to see how bad measles was, and guess what? Vaccine rates increased because people had personal experience of the disease. And say, yes, there is a value to these vaccines, rather than focusing upon the fear that vaccines might be bad, they might be terrible. Now again, let's be absolutely clear and honest. You have to put every vaccine through a safety check. You've got to make sure that there are no unintended side effects from them. And if you don't do that, then we're not serving our population in the way that we should be. We have to accept also that the world's changed. In the 1950s, people did what their doctors said. Trust me, I'm a doctor. Now people don't trust you because you're a doctor. They say, well, you show me why I should trust you. You give me a reason to trust you. I want to see the evidence. That's a lot of people. There are other people, though, who are strangely gullible. And I think a lot of that's to do with the power of used to be the internet, now it's social media. And social media can spread a virus of ignorance and a virus of mistrust much faster than we can spread viruses between humans. And the social media can outpace the spread of a real epidemic, and this can be an epidemic of ignorance. And unfortunately, people don't always know what's a reliable site. So we shouldn't be criticising parents who don't want to vaccinate their children, because parents care about their kids. They want to do the best, and so their decision not to vaccinate will be made on the grounds of, I think I'm worried about the side effects, I'm concerned that it could hurt them, I've read these things, I don't want my child to get sick from the vaccine. So it's not based upon neglect, it's not based upon stupidity, it's based upon caring for the kids. And it's our responsibility as a community, as medical practitioners, as health practitioners of any sort, of the general community, to explain to people why it is actually in the interest of your child to be vaccinated. Vaccination is not just a self-interested act, it's an act of altruism. It's saying that I belong to this society, and one of the responsibilities of my society is to protect other people. So when I drive my car, I do not speed, I do not drink, I take responsibility. It's not just me. When I live in a community that is at risk of infectious disease, as every community is, then one of the things that we do is we vaccinate our children. One of the things I do fear for is the children of people who have an objection to vaccine. So the anti-vaccination group who put that belief onto their children. They become adults and they travel outside of Australia, outside of a country where the vaccine rates are very, very high, and therefore these vaccine preventable diseases are rare. They've only got to go a few hundred kilometres offshore to countries like Indonesia, to Papua New Guinea, to the Pacific, to areas where these diseases still exist. And these poor young people are now at great risk. There's a false sense of security that the high vaccine rates in Australia provide to people locally. Those kids are at terrible risk, and they must be vaccinated, and they will learn the hard way what it's like to go to a country where there isn't the same level of vaccine. There's been an amazing effort made, led to saving of thousands, millions of lives. It's been estimated that the vaccine for measles over the last 20 years has saved 17 million lives. Although we still think that there are about 115,000 deaths from measles every year. So whooping cough's a really important case in point. Anybody who's seen a case of whooping cough never wants to see it again in a little baby. It's the newborns who cough and cough and cough until they go blue and stop breathing. And it's a shocking thing to watch. It's just awful. We do see more whooping cough today than we saw in previous decades. So there has to be a concerted effort to get as many people as possible vaccinated, and we also may have to, and we do have to, extend that into adults as well. So it's quite important to protect families. So if you have a pregnant woman in the family, it's really important that the members of the family are vaccinated, and grandparents too, so that anyone who's going to be in close contact, particularly with a newborn, are not going to give the child whooping cough. So don't hesitate, vaccinate.